This is Shooey. Fun-loving, feisty, smart, a retired Army nurse. You wouldn't know it seeing her now, but she's had a year of agony.
I had an ingrown toenail, and it just wouldn't heal, and I went to the podiatrist. It just got worse and worse and worse. The orthopedic surgeon said, "You have a pinched nerve in your back," so he injected my back. That didn't work.
She was frustrated, but more than that, the pain in her foot was getting worse and worse. She couldn't sleep.
I'd be up most of the night crying, and I can take a lot of pain, and I don't take narcotics. But this pain was unbelievable.
Her friend and caregiver, also a retired nurse, lives downstairs.
Well, she got me a doorbell, and so she had the doorbell downstairs, I had the button upstairs. So I would ring the doorbell and she would come up, and I would just be sobbing with the pain. So she would sit up with me.
It was absolutely horrible. To the helpless feeling that I would have, Shooey would be in her bedroom crying with pain, and I would go in, "Shoo, what's the matter? What can I do?" And there was nothing I could do other than try to comfort her, let her know I was there. It's the worst feeling for a friend, a caregiver, a family member, to see someone in such exquisite pain that all the narcotics in the world are not going to take care of.
The third trip to the emergency room brought an answer.
And this 4-year female resident, they finally put a blood pressure cuff on my leg and on my arm. And she said, "I think you might have a vascular problem. Maybe you better check with vascular."
Which got her to Dr. Globova's office.
And they did all sorts of ultrasound. Dr. Globova came in the room, and you know, she can be very serious. And she just looked at me and she said, "You know, you're lucky you haven't lost your leg." And I just looked at her, you know, I told her afterward, I said, "You know, you scared the heart out of me." But we got to be really kind of friends, you know, through this whole thing. And she said, "You need surgery, and you need it now." And I said, "That's fine. Whatever I need, let's do it."
Peripheral arterial disease is hardening of the arteries. It's a process that normally happens with aging, but it can be accelerated by a number of factors. Probably the most important ones are smoking and diabetes.
Most patients with peripheral arterial disease that I see have pain with walking or claudication. So they experience pain in their calves when they walk at a certain distance. You know, a lot of my patients are older and they've been through pain before and they've had a lot of experiences in their life. And when they have pain at rest due to critical disease of their arteries, that is debilitating to them.
We don't really have any medications, pain medications, that can touch that pain. So if you have a limb that went from 70% circulation to suddenly 0 or near that, the pain is incredible. It basically is the worst pain you've ever had, stops everything you're doing, you have to come in immediately, and unless we can restore circulation, the only option to really eliminate the pain is to eliminate the source, which is to eliminate the limb. So it is a process that once it has begun does not have a lot of great solutions.
Shooey feels lucky. She had revascularization surgery and has her life back. That includes bowling, of course. But her doctors hope that research will lead to other treatment options with more long-lasting outcomes.
So in terms of research, for my patients with peripheral arterial disease, it is quite heartbreaking for me to see a patient who, let's say they had a rest pain or a non-healing wound and I fixed it by opening up their artery either with a stent or a balloon or doing bypass surgery, and only to have them end up having a heart attack or a stroke 2 months later, just because they have arterial disease in other in distributions. So for me, I think it would be a breakthrough to be able to identify a medication that would decrease the patient's risk of heart attack or stroke after I revascularize them, so they can enjoy their life with new blood flow to their extremity.
An agent that could lower the thrombotic events would be a major advance for the patient. So the patient's perspective is really, that they're walking around not knowing if they're going to suddenly have some major catastrophic block of circulation. We see it reported all the time. My father was from a very large agricultural family. I had 8 aunts and uncles. And every single one of them died of some arterial-related illness. Now, I have firsthand experience of, basically spending an entire decade going to multiple funerals.
And I think if you view the patient as, your family member, or just think about the fact that you have a mother, father, husband or wife, children, what if that was them? Would they want the most compassionate approach? I think so. They would also want somebody who knows what they're doing, is good technically, but that, in addition to compassion, I think makes the patient feel much better. And may or may not influence their outcome, but I think that it influences their overall experience.
This is what this research is about. People, like Shooey.
You're not just a number on a page or on a chart. You're a human being with feelings. And I think sometimes the doctors forget that. Dr. Glebova didn't, but I think a lot of the doctors do. They just are treating a limb, a leg. They forget that there's a face and a heart and